You don't usually hear your doctor say, take care of your kidneys, but take care of your heart, certainly. These two major organs are frequently undervalued. Did you know your kidneys do more than just filter waste? These small organs are responsible for some incredible functions that keep your body running smoothly. Your kidneys filter about 50 gallons of blood daily, removing toxins and excess waste to keep your body clean. They regulate your fluid and electrolyte levels, keeping your body in balance. Important for hydration and blood pressure control. They release erythropoietin, which stimulates your bone marrow to produce red blood cells, vital for oxygen transport. If they begin to malfunction, toxic waste will accumulate in your body and cause other organs to fail. Daily repetition of seemingly harmless activities can silently kill your kidneys, putting your life at risk. About 9 in 10 adult Americans do not notice kidney problems until they become serious. Our bodies often mask early kidney disease, causing severe damage before symptoms appear. Damage to the kidneys is frequently irreversible, so people who don't take care of their kidneys may face substantial health concerns that ending in dialysis or even a kidney transplant. But did you know that certain habits can seriously damage them over time? In this video, we're going to explore 15 habits that destroy your kidneys. Let's take a closer look at why these habits are harmful, how they impact kidney health, and what symptoms to watch out for. Number 1. Excessive salt consumption. High salt intake is one of the most common habits that damage kidneys. We all know that too much salt can raise blood pressure, but did you know it can also directly harm kidney function? When you consume excess salt, your body retains more water to balance the sodium levels, which increases blood volume. This forces your kidneys to work harder to filter the extra fluid and regulate blood pressure. According to estimates, the average American diet has 3,300 milligrams of sodium per day, which is significantly more than the recommended daily limit of 2,300 milligrams, about 1 teaspoon of salt, for healthy adults. According to the Centers for Disease Control and Prevention, 75% of the sodium Americans consume is found in processed food and restaurant meals. Other typical foods high in salt that can be hiding in your refrigerator or pantry include canned soups, frozen pizza, frozen dinners, processed meats like lunch meats, hot dogs, sausages, canned vegetables. Number 2. Consuming too many sugary beverages or sodas. Although sodas are undesirable, do you know how much they can damage your kidneys? A recent study indicates that consuming 2 or more carbonated sodas per day, whether regular or diet, may raise your chance of developing chronic kidney disease, according to the American Kidney Fund. Kidney stones have been associated with both carbonated and energy beverages. Sugary drinks include fructose and the presence of additives like phosphoric acid in certain sodas, which may increase the body's uric acid levels and the formation of stones, later cause kidney injury. Limit sugary drinks. Minimize your consumption of sodas and other sugar-sweetened beverages. Choose water. Opt for water as your primary beverage choice. Guidelines set by the American Heart Association, for example, limit daily sugar intake to 9 teaspoons for adult males, 5 teaspoons for female adults, and 3 teaspoons for children. A 20-ounce bottle of soda contains nearly 12 teaspoons of sugar, 33% more than recommended for adult men, and 4 times the amount children should ingest daily. Number 3. Excessive alcohol consumption. Dangerous toxins are removed from your blood by your kidneys. Alcohol is one of these drugs. Drinking alcohol can alter how the kidneys work and reduce their capacity to filter blood. Alcohol also interferes with the body's capacity to control electrolytes, and alcohol consumption can damage the kidneys, resulting in liver disease, dehydration, and elevated blood pressure. Blood pressure can also be impacted by excessive alcohol consumption. High blood pressure is more common in people who drink excessively. When alcohol dehydrates, dries out the body, the drying effect can affect the normal function of cells and organs, including the kidneys. Heavy drinking is defined as consuming more than 3 drinks in a single day, or more than 7 drinks per week. For women, and more than 4 drinks in a single day, or more than 14 drinks per week, for men. Heavy drinkers' kidneys must work harder. Regular heavy drinking has been shown to double the risk of renal damage. Number 4. Overuse of painkillers. What should you do if you have a fever, headache, or sore muscles? It's likely that you purchase an over-the-counter, non-prescription pain reliever from your neighborhood pharmacy. These medications work well and are typically safe. It's crucial to understand that no medication is risk-free, though. Use these with caution. Inappropriate usage of painkillers can harm the kidneys and other parts of the body. The National Kidney Foundation estimates that excessive use of opioid painkillers may be responsible for up to 3 to 5% of new cases of chronic kidney failure annually. Chronic renal issues may result from long-term daily usage of one or a combination of these medications. We refer to this as analgesic nephropathy. The most likely medications to damage the kidneys are those that contain caffeine or codeine, along with 2 or more medications, for example, aspirin and acetaminophen. The most typical signs of analgesic nephropathy are as follows: weakness or fatigue, feeling ill, hematuria or blood in the urine, an increase in the frequency or urgency of urinating, back or flank pain, which is where the kidneys are located, a reduction in the amount of urine produced, diminished attentiveness including fatigue, disorientation, or sluggishness. Non-prescription pain medicines should not be used without your doctor's permission if you know you have low kidney function. You ought to take painkillers, just as directed or as stated on the label, at the lowest dosage feasible and for the least amount of time. Number 5. Overtraining exercises. Avoiding excessive physical exertion is crucial. In fact, prolonged intense exercise can lead to rhabdomyolysis, a disorder in which injured muscle tissue degrades quickly. When a muscle is severely damaged, its fibers can break down and leak a protein into the bloodstream that can get stuck in the kidneys. Myoglobin, a protein that can degrade into compounds that harm kidney cells, is released by injured muscles. Your kidneys fail as a result of the toxins being dumped into your blood too quickly. Symptoms include muscle weakness, stiffness, pain, and a change in urine color. You will need to be admitted to the hospital in order to receive treatment for rhabdomyolysis. Maintaining urine output and preventing renal failure are 2 benefits of IV fluid treatment. A professional physical trainer can assist you in progressively increasing the intensity of your workouts if you want to increase your level of physical activity. Avoid working out in extreme heat and humidity, and don't abruptly increase the intensity of your physical activity. Number 6. Uncontrolled diabetes. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. The hormone insulin controls blood sugar levels. Diabetes that is not under control can harm neurons and blood vessels, including the kidneys. Diabetic nephropathy, a disorder marked by kidney damage, may result from this. These arteries may contract and clog as a result of elevated blood sugar levels over time. In order to preserve kidney health, diabetes must be properly managed with medication, food, and lifestyle changes. According to Diabetes Canada suggests a hemoglobin A1C target level of 7% or less. Eat healthy foods. Follow an eating plan that is best for your diabetes. You may want to work with a dietitian to make a plan. This will help you know how much carbohydrate to have for meals and snacks. It will also make sure that you get the right amount of salt, sodium, fluids, and protein. Stay at a healthy weight. Work out. On most days of the week, get in at least 30 minutes of exercise. Walking is a terrific option for a lot of folks. You can maintain a healthy weight and control your blood sugar by increasing your level of physical activity. Additionally, it can help decrease blood pressure and cholesterol. Number 7. Holding in urine. Prolonged postponement of urination raises the risk of kidney damage and urinary tract infections. Constantly having a full bladder might strain the kidneys and possibly affect how well they work. Pay attention to your body's cues and prioritize taking frequent restroom breaks. The pressure inside your bladder rises when you hold pee, which can strain the kidneys and ureters and possibly harm their fragile tissues, potentially damage their filtering function, a condition called hydronephrosis. Overstretching the bladder by holding urine for extended periods can weaken its muscles. The pelvic floor muscles may be harmed by persistent urine retention. The urethral sphincter, one of these muscles, maintains the urethra closed to stop urine from escaping. Urinary incontinence could result from injury to this muscle. Before filling up, a healthy human bladder can hold 500 milliliters, or around 2 cups of urine. Urinating at regular intervals is crucial, even though a healthy bladder may expand and hold bigger volumes of pee. Number 8. Smoking. Nicotine and other chemicals in cigarette smoke can harm blood vessel linings, causing atherosclerosis, artery hardening, which further reduces blood flow to the kidneys. Because nicotine has vasoconstrictive effects and because cigarette smoke contains dangerous substances like cadmium that can damage kidney cells directly. By destroying blood arteries, it drastically lowers blood flow to the kidneys, making it more difficult for them to filter waste items efficiently. This eventually damages renal tissue gradually and may eventually result in chronic kidney disease, CKD, and kidney failure. Smoking can elevate blood pressure, putting additional stress on the kidneys. Number 9. Urinary tract infections. Because of their shorter urethras, which allow bacteria to more easily enter the bladder, women are more likely to get UTIs. If you have UTI symptoms include burning or pain, when urinating, frequent urination, or murky urine, please consult your primary provider for proper treatment. If left untreated, the bacteria that causes the infection can spread up the urinary tract and infect the kidneys, causing pyelonephritis, which can harm kidney function. This is particularly dangerous for people who have structural abnormalities in their urinary tract that make it easier for urine to return to the kidneys. In order to get to the kidneys, where they might grow and cause infection, bacteria that cause a UTI in the bladder can ascend through the ureters. Kidney stones can obstruct urine flow, trapping bacteria and promoting infection in the kidneys. Number 10. Insufficient drinking or dehydration. Dehydration, or inadequate water intake, can result in kidney failure because it hinders the kidney's ability to filter waste from the blood. It takes a period of more than 24 hours to enter severe dehydration. This can lead to a buildup of toxins in the body instead of being eliminated through urine. When dehydrated, the body conserves water by reducing blood volume, which means less blood reaches the kidneys to be filtered. To compensate for dehydration, the kidneys produce more concentrated urine, which can put stress on the filtering mechanisms, which can lead to the formation of crystals and kidney stones. Prevention is the key when it comes to dehydration. This entails consuming sufficient amounts of water. For some, that is too little, and for others, it is too much. The appropriate amount is determined by your body size, degree of exercise, and if you are breastfeeding or pregnant. It also helps to plan for physical activity or extended exposure to heat. Before starting your exercise, make sure you have adequate water on hand and consume it. Thanks for watching, and don't forget to share your own habits in the comments below. What changes are you making to protect your kidney health, and what challenges are you facing? Let's support each other on this journey to better health. And if you want more tips and advice on how to improve your kidney health, be sure to check out my other videos on health and wellness.